We have been users of the MCG chronic care guidelines and outpatient care management since 2021. The program that we submitted and won the award for our high utilizer care plan program has been in place since 2017. And um, the program itself is provider led, but care management provides the wraparound support. So the use of the chronic care guidelines has been useful in creating goals with those patients who frequent the emergency departments or get hospitalized often to keep them on target and help prevent them from going to the hospital as much. For high utilizer, we've had very consistent data. I'll be showing data for 2025, but our data has been very consistent for several years of reducing readmissions, admissions, ED visits. One of the most surprising metrics that we saw a decrease in was a decrease in high-end radiology studies, where we were sometimes doing more harm than good with patients. And so that's kind of helped us show an ROI of quality. St. Luke's was recently recognized being number one by the U.S. Department of Health and Services, a number one in quality in the United States. So that's extremely important to us to make sure that we are keeping, quality in the forefront and improving patients' quality of life. So our program allows clinicians, when patients hit the ED, to say, "Oh my goodness, they've had 8 CAT scans this month, and unless it's clinically indicated, we might not need to do that today." So that's one of the most surprising things. With care management overall, we do see an increase in the patients following up in the outpatient setting. However, because these are such high utilizers, we've seen kind of the opposite. Follow-up kind of goes down, which we've kind of looked at that a few different ways. And really, it's making sure that they have access to care and access to care appropriately. So if they're not, it makes sense that if they're not being admitted as much, they're not having as many transitional care management visits with their primary care. But then if you look at when they are going, it's more appropriate utilization of their primary care, like their annual wellness or their just routine follow-up. We're published also in Curious Medical Journal January of this year for the high utilizer program. So I think the secret to it, we never look at it and say it's perfect. We don't have to do anything else with it. We're constantly trying to evolve it and make it better. In hospital charges, we've saved over $400 million with the program. I think for our ED, we see about a 40% decrease in the first 6 months of having a care plan, and then that increases over time to around 60%. And a lot of our admissions, I think over time, their admissions go down by 60, 70%. So it's a huge decrease. Oh, very excited. I have a group of people here with me who are part of care management and the high utilizer team. So they're here with me this week. They recognize this in the local newspaper, on our MyNet page. And so all the way up to our CEO, he was like, "Hey, I heard we won this award," that kind of thing. So yes, everybody's very excited that we're here and that we won the Richard Doyle Award.